and it matches up with the nipple right here. Okay. Fifth intercostal, so this is stomach 17 right on the nipple. The fifth intercostal is one more down, so right here. Okay. This would be where our stomach 18 is located. Okay, so about here, yeah. Sorry. Okay. And then after that, the channel, again, it kind of truncate, it goes in, right? And that's at stomach 19. Okay, so, okay, I'm trying to feel for the, yeah, that helps, yeah. So he's contracting his abdominal muscles, so I can really feel the edge. This is the lateral edge of the rectus abdominis out here, okay? And as you can see, it kind of matches up with the mammillary line. If we take this line up, it kind of joins up. So this is foursun lateral, okay? And I'm going to find stomach 25 first. So if this is foursun lateral, we take half of that, and that'll be 2sun lateral to the midline, and that's stomach 25 right here. So, okay, if we're trying to find like stomach 19, okay, this is the umbilicus. I try to find the sternocostal angle. So what I do is I just slide my fingers up until I fall into this valley. So it kind of feels like this, yeah, like a box valley. Okay. This will be my sternocostal angle right here. Okay. So this distance is 8 sun. Half of this is going to be 4. Okay, another half right here is going to be 6, right? 6 superior to the umbilicus. So if I wanted to find the stomach 19, then I go at this level and I go about 2 sun lateral. Okay, one issue about stomach 19 is that depending on the patient, there's some patients who have really narrow
waist?
Well, narrow ribs at this point. So although ideal, this point is still fine. It's just on the border between the ribs and the abdominal muscles. But there's some patients where, I mean, the ribs are like here, and you'll be right on the rib cage, like right on the bottom of the rib. So
but that's okay though, right?
Well, you have to adjust. You have to move. You can't needle directly on the rib. So sometimes you'll have to like move slightly down. Yeah. But that is 19, and then let's see. I'll just find some of the other representative points. So this is 6 sun, yeah. Let me find 8 again. I like to use the 8 landmark first. So 8, and then 4, and then this is 6, right? So if I wanted to find 21, that's 4 sun above the umbilicus, yeah, and 2 sun out. So I go like about here. Yeah, this is going to be stomach 21. Okay. Stomach 23 is 2 sun down here, okay? But 19, 21, this is 25, okay? And, okay, from here, okay, this can be another, delicate area, okay? But from the umbilicus going down, this distance to the top of the pubic symphysis is 5 sun. So you can, use the edge of your hand. This is a little bit less intrusive than going in this way. Okay, but okay. You can just go down until you feel the top of the pubic symphysis, okay? And this distance from here to here is going to be 5, okay? So 5 is, a little bit harder to divide up, yeah, but it at least gives you a way to estimate. So if I wanted to find something like stomach 28, which is 3 sun below stomach 25, then, if I take about half of this distance, that'll be 2.5, and I go a little bit further, that'll give me my stomach 28 right there, yeah? So it would be something like this. I can put this down. It doesn't look really right, but yeah, one lateral.
You're going to get thin meals.
Is stomach 30 on
You're going to
the
get thin
pubic
meals.
symphysis?
It's right. It's right,
right-
at the right above
Filmed
it.
Okay.
Yeah. Okay. Okay, but is everybody kind of clear about the stomach, how the stomach channel operates or whatever?
So this is 111. Is that 2?
Okay, yeah, this distance might be a little bit more just because you know, the clavicle kind of curves up this way, and then I'm just going straight from the first intercostal space that I feel at the midline. Actually, what happens with the ribs is that they do curve upward this way, but I like to just make it simple and feel for the level at the sternum here and then go out. Because, I mean, you can't, you know, for one thing, you can't really palpate the curvature of the rib cage and, you know, just follow it all the way out. A lot of people have like too much like muscle tissue here. So I just find the level at the sternum and go work my way forcing out to find the point. Okay. So any questions about that? Okay.
So from this to here is 8. Here is 5. From here to here.
From here to here is 8.
Right.
From here to here is 5. There's no
Oh, from there. No,
yeah, from the
no reference.
There's no yeah, they don't talk about some measurements in this area because the only thing that
many
divides
valleys.
points up is the intercostal spaces. Yeah, and there's no formal. I mean, I guess they could measure what an intercostal space is in terms of swimming, but they usually just, you know, feel for the intercostal spaces. Okay. All right. Let's stop there.
Brandon, you're going to get thin nails.